Hi, these exercises are called reverse tendon glides, and the purpose of these exercises is to work to increase the range of motion of the fingers and to also decrease any swelling in your fingers. These are just terrific exercises for anybody that has swelling in the hand or stiffness. So here we go. The first position is your fingers are pointing straight up. This particular exercise, we're not dealing with the thumb too much. It really has to do with the four minor digits, the index, the middle, the ring, and the small. So here we go, straight up. And you notice this position has got the most extension of all of the digits. Everything is as straight as it possibly can be. The second position, or B position, we call it, is the wrist is fairly straight, and you'll notice I'm bending the big knuckle, which we call the metacarpal phalangeal joint, the big knuckle. We're bending that only, but we're keeping the joints on the fingers as straight as possible. And this is a tough exercise. It really strengthens up the muscles right in the palm of the hand. And that's the purpose for this. Now, the next portion of this exercise C is we're pulling the fingers down, and we're trying to get all the fingers to point down towards the elbow. And you'll notice during this portion of the exercise, I'm getting a lot of flexion at the metacarpal joints. In this position, you'll have the most flexion of those big knuckle joints. And it's a good thing to do because during your normal day, you don't really stretch these knuckles to that extent. The D position, the fourth position, is what we call a composite fist. So now it's sort of that, that position like you're going to hit somebody, where everything is bent. The big knuckle is bent, all the knuckles in the fingers are bent. And then going from the fourth to the fifth position, moving from position D to E, I go into what I call a hook fist. And you'll notice everything is very tight as far as the two joints on the finger. The PIP and the DIP, this is a point of maximal flexion. When during your day do you have these joints flexed as tightly as they are right now? So let's actually go through the exercise, and here we go. We go at this pace. Position A, straight up. It's called full extension. Position B, all right. Position C, that's called a flat fist. Again, the fingers are pointing down towards the elbow. Position D, a composite fist. And then when I go from position D to position E, we go to a hook fist. Notice that I didn't go from the fist, the composite fist, to a hook fist this way. Notice I held it in this fourth position. I held it and slowly went into a hook fist like that. So here we go again. Position A, position B, position C, position D, and very important, hold position D and go into what we call the hook fist. In this exercise, you would do 10 repetitions. Make sure you get to each position before you go to the next. You might not be able to do this exercise and get your fingers bent or straightened as much as I am, but just sort of give it an effort, and eventually, in a lot of cases, you will be able to get this kind of range of motion. I get a lot of patients, they come into the clinic and this is all they can do, and so they just try to straighten it out. This is the best they could do for the A position. Maybe they're sort of like this for the B position. Maybe that's the best they can do for C extension. So it's better to just go through the motions and try each position and then move on. Don't feel like you have to do it exactly. So A, B, C, D, and E. And if you want to really make it harder, you could do this, or make it better, I guess. Bring the hand up, and then you can take the other hand and slowly try to straighten the fingers. Look at that. And then I go to here, and I can take the other hand and try to help it out. And then I go down and I maybe push with the other hand. And then what I do is I push as far as I can, I let go and hold it in that position for 3 seconds. And then maybe I get to this position, but I need some help. So I come around and I help with the other hand, squeezing them. I try to hold it for 3 seconds. And then maybe I go into this position, I can't get there fully, I use the other hand to help out, squeezing, I let go, 1, 2, 3, and then move on. So again, this would look something like this. I'd use the other hand, help, count, 1, 2, 3, move on, use the other hand, push down. Oh, that's as far as I can do. I let go, 1, 2, 3. I go down, that's as far as I can go under my own power. I push further. That's as far as I can push it. I let go, 1, 2, 3. I try to go into a composite fist. That's as far as I can go, so I help it. And then again, I let go, 1, 2, 3, trying to hold it. And last but not least, I would go back like this, come around, try to squeeze it in, let go, 1, 2, 3. So that would make that exercise a little harder. Great exercise, 10 seconds for each one, or excuse me, 10 seconds probably to do the whole exercise, maybe less. And that was 1 rep, 2 reps. You would do 10 repetitions every 2 hours. Great exercise. You could do that six times a day, maybe 8 times a day if you did it every 2 hours. Terrific for swelling and getting rid of stiffness.